Cold agglutinin disease, or CAD, is a very rare autoimmune hemolytic anemia. It comprises only 15% of all autoimmune hemolytic anemias. And what is special about cold agglutinin disease, or primary cold agglutinin disease, is that it almost always occurs with the IgM monoclonal protein, which in the majority of patients is IgM kappa. But when you look at all patients with IgM kappa, including MGUS or Waldenstrom's, only a minority of those patients will develop cold agglutinin disease. And it's always a conundrum why there are so many patients with IgM kappa monoclonal protein. Why do only a few patients develop cold agglutinin disease and hemolysis? And so we've seen that in other diseases where protein structure plays a role, like amyloidosis. Not all patients with monoclonal protein develop amyloidosis. We found that the protein structure or changes in the protein structure in some patients make them more likely to develop amyloidosis, like glycosylation is one of them that me and my colleagues have looked at. So we thought, well, maybe there's something to do with the structure of the IgM protein in patients with cold agglutinin disease that makes them more likely to develop cold agglutinin disease, whereas other patients with IgM monoclonal protein may not have those changes, and that's why they don't develop cold agglutinin disease. And so our hypothesis was that we would likely see an increased likelihood of glycosylation in patients with cold agglutinin disease. And that is what we found. So we analyzed samples of all patients with the IgM monoclonal protein over a course of a year or more, and there were about 400 patients. And these were analyzed by mass spectrometry, which can pick up the mass of the protein and can also tell if there are any changes to the protein structure, like glycosylation, addition of other residues. And so we found that only 7% of patients in all of those 400 had glycosylation. But, glycosylation was highly enriched in cold agglutinin disease patients. So 2/3 of patients with cold agglutinin disease had glycosylation, even though that was very rare. So in that 400 patients or so, only 14 patients had cold agglutinin disease, but 2/3 of them had glycosylation. Or if you look at the other way, if you find somebody with glycosylation, 1 in 3 chance that they will have cold agglutinin disease. So I think this is, again, if you see somebody with an IgM protein and now this technology is used more and more in routine care and the report says, oh, they have glycosylation, that should just trigger a cue in the diagnostic, algorithm that, okay, we should look for cold agglutinin disease. Or if you're really suspicious about cold agglutinin disease, send that test and look for glycosylation. It's not foolproof, it's not there in everybody, but I think it's a very strong diagnostic tool.